My name is Dr. Olayemi. I am the director of the Ghana Institute of Clinical Genetics, where the premier adult sickle cell disease clinic in Ghana is located. I'm also a consultant hematologist to Korle-Bu Teaching Hospital, as well as the head of the Department of Haematology, University of Ghana. Sickle cell disease is an inherited disease. Okay? It's a disease that affects the hemoglobin. And the hemoglobin is what gives the blood its red pigment. One of the main functions of hemoglobin in the body is to transport oxygen. Now, there are several types of hemoglobin. In the adult, we have what is known as hemoglobin A. And for the newborn baby, we have what is known as hemoglobin F. So those are the normal types of hemoglobin. However, there are some other types of hemoglobin that we know of. One of the important ones in our environment is hemoglobin S, as well as hemoglobin C. It's also very common in Ghana. So for every person that's alive, usually you inherit one type of hemoglobin from either parent. So either you inherit hemoglobin A from your father and hemoglobin A from the mother, and that person is said to have hemoglobin AA. Okay, and that's what's supposed to be the normal genotype or phenotype, as we call it. Now, there are other people who might inherit hemoglobin A from one parent and hemoglobin S from another parent. Those people are said to have hemoglobin AS, and they have the sickle cell trait, or sometimes they are referred to as carriers of hemoglobin S. Then if you go further down, there are people that have hemoglobin S from one parent and inherit hemoglobin S from the other parent. That person will have hemoglobin SS, and that will be sickle cell, one type of sickle cell disease. Another type of sickle cell disease is where you inherit hemoglobin C from one parent and hemoglobin S from another parent. That will be hemoglobin SC. Again, that will be another type of sickle cell disease. So those are the two common types of sickle cell disease that you find in Ghana. Usually at birth, a person with sickle cell disease is as normal as any other baby, because that person has hemoglobin F, mostly hemoglobin F, like any other child. But once the child is born, the amount of hemoglobin F in the system starts to drop gradually, and ideally it should be replaced by hemoglobin A. Okay, but for somebody that has sickle cell disease, when the child is born and the hemoglobin F starts to drop, rather than being replaced by hemoglobin A, that child the hemoglobin will be replaced by hemoglobin S, okay, or SC, based on the type of sickle cell disease the child has. And that is when the child starts having problems. And this switch usually occurs at about 6 months. So about 6 months, we expect that most of hemoglobin F will have been replaced by either the normal hemoglobin A, or in case of somebody with sickle cell disease, hemoglobin S. So usually most children will start having symptoms around the age of about 6 months to 1 year. They might present in several ways. Could present with swelling, okay, of the hands and feet, what we refer to as dactylitis. It's very common in children. Another common problem is anemia. They might develop anemia, they might become jaundiced, the child might not feed as necessary, okay, so it might not grow very well. And each of these symptoms I'm talking about occur at different stages in different people. So it's not as if everybody has a time frame when with sickle cell disease. There are people that don't even have very severe symptoms until they are adults. But we know that for sickle cell disease, the main complications of the disease are the issue of hemolysis. That means the red cells in the body are broken down faster than usual. A normal red cell is supposed to live for about 90 to about 120 days. But for somebody with sickle cell disease, the red cells live for about 20 to 30 days. So these red cells are broken down very fast. The child becomes anemic. The child can become jaundiced. Okay, you can have enlargement of the spleen. Okay. Then there's the issue of bone pain crisis. So they develop crisis. They have severe pains in their bones. These pains could also occur in the abdomen, could occur in the chest. Okay, and one very feared complication of the disease is stroke. because patients with sickle cell disease are prone to developing strokes. So these are some of the common findings that we find. But as the child grows older into adulthood, then you start having other features of the disease, like problems with their eyesight. Okay, for the men, they can develop erection, which does not go down over time. You can have problems with their hips, so have what we call avascular necrosis of the head of the femur. So sometimes they are unable to walk and balance properly, and they're also prone to infections. Okay, so infections either of the chest, of the urinary tract, of the bones, because their immunity is a little bit compromised because of the disease. When we talk about treatment, we have always had what we call supportive treatment. Okay, so supportive treatment in the fact that if somebody has a fever, you can look for the cause of the fever. You can give antibiotics, you can give anti-malarials. Okay, if they have bone pain crisis, you can give them painkillers to relieve the bone pain. Okay, if they are anemic, you can be transfused with red cells as and when necessary. So all of these are supportive treatment. But when you talk about treatment that is definitive, that is curative, the only treatment known currently that is curative is stem cell transplant. Okay, but then for you to be able to have stem cell transplant, first of all, you need to have a compatible donor, and it's very difficult. I mean, not everybody is able to get a compatible donor. There's also the issue of the cost of the procedure, as well as the risk involved. So though stem cell transplant could be curative, it is not available to everybody for these reasons I've mentioned. There are other drugs that have been in trials. One of the common ones is hydroxyurea, which is commonly used in more developed parts of the world. In our parts of the world, we have been relatively slow in embracing the use of hydroxyurea, mainly because of the fear of possible side effects. But we have a few patients who are on it, and some of them are doing quite well. Life expectancy for sickle cell disease has improved by leaps and bounds over the past several decades. I know that when I was a kid in primary school, it used to be said that somebody with sickle cell disease will not survive past their 18th birthday. But that no longer holds, because now we realize that with comprehensive care for a patient with sickle cell disease, especially if the child is diagnosed early, that is why we try to campaign for newborn screening. Okay, of every child that is born in Ghana should be screened for sickle cell disease. The screening methods are not very expensive, and they are relatively easy to carry out. So if the child is diagnosed early and some of these preventive measures are put in place, okay, so the parents are told that, oh, this child, if you notice that the child is jaundiced, okay, or the spleen, they are taught how to palpate for the spleen. If the spleen is getting enlarged, you should come to the hospital. If the child has an infection or has bone pain, you should come to the hospital. They are vaccinated against some of these infections. With all of these modalities and all this supportive treatment put in place, most children now are able to survive beyond childhood. So we on the adult side, because I'm an adult hematologist, so I take care of adult patients with sickle cell disease, we are beginning to see people in their 50s, people in their 60s, and even the oldest patient at our clinic now is about 89 years old with sickle cell disease. So I would say the life expectancy of patients with sickle cell disease in Ghana has improved over time. That's not to say that we don't lose patients. We are still losing quite a number of our patients, but it's not as it used to be, but then we can improve on it. Sickle cell disease is endemic, like I said earlier, in Ghana, and we would like everybody to come on board. A lot of people with sickle cell disease, because of the stigma attached to the disease, tend to hide away and don't want other people to know that they have the disease. But I will encourage them to come out, okay, especially those of them that are doing very well, who are survived into adulthood, so that we can serve as a source of encouragement for the younger ones going up, so that they will know that, okay, this is not a death sentence. Even though they have sickle cell disease, they can live a fruitful life, they can contribute immensely to the nation. Apart from that, we also want to call on the government and other philanthropic organizations to partner with us. We need to screen all the newborns born in Ghana for sickle cell disease. And apart from that, even the adults, okay, right now at the institute, we go out regularly to the senior high schools around to screen them for free, so that these students are able to know about their sickle cell status before they start entering into relationships and giving birth to children.